China continues to ease its strict zero COVID-19 policy and is moving forward in its efforts to coexist with the virus. The Asian country ensures it is in a new stage in the fight against the disease, considering the low virus infection rate of the new strains and the progress made in the vaccination campaign, especially among the elderly.
3 years after the outbreak of the COVID-19 pandemic, China is now entering a new phase in the fight against the virus by lifting the quarantine for travelers arriving in the country, as well as other health measures. Experts agree that lower viral loads, improved medical resources, and progress in mass vaccination, especially in the elderly, gave China the confidence and strength to overcome the pandemic. The announcement that as of January 8th, China will reopen its borders and eliminate the quarantine requirement, a measure that had been enforced since 2020, has been highly anticipated and is an important step towards resuming normal life and also for international trade.
Over the past 3 years, we have always put people's lives and health first. We made sure that patients with severe symptoms receive early treatment and have focused medical resources and trained medical teams. We are now in a new phase in which we will continue to work in a more focused way to protect people, but also to stabilize daily life.
With these decisions, China is moving further away from its strict zero COVID-19 policy and moving towards coexistence with the virus, as is the rest of the world. However, the country's health officials confirm that this does not mean abandoning all prevention and control measures against the disease, and ratify their readiness to deal with any risk in the face of a significant increase in the number of infections. In this context, Beijing is also working to increase and expedite vaccination against COVID-19, especially among the elderly, who are the most vulnerable age group in the midst of the new outbreak in the country, considered the worst since the outbreak of the pandemic.
With this, we have